Hi, this is Dr. Jim Anderson from Anderson Podiatry Center for Nerve Pain, here to talk to you today about recovery from nerve surgery. And as you know from some of the other videos, or you may just know through word of mouth, that we do surgical procedures to open up tunnels that we feel are tight to help patients that have symptoms that are restless leg symptoms or neuropathy type symptoms, because we really do believe that compression or tight tunnels have a big role in causing your neuropathy symptoms and your restless leg symptoms. So what I want to go over is just a little bit very quickly about how much or how little you're laid up. When we're talking about these surgeries, there's 5 tunnels that we're talking about. 2 of them are in the foot, and the other 3 are above the ankle on up the leg, okay? And the one tunnel that will lay you up the most is here on the inside of the foot. It's called the tarsal tunnel. So here's a big toe, but in this area is the area, the pathway for all the nerves that go down and supply the bottom of the foot. This incision notoriously is slower to heal. So it doesn't take you 3 months to heal. I don't mean it that way, but simply we want you not to bear weight in many cases for the first 3 or 4 days, okay? Simply to allow the incision to heal, okay? It's the only incision that we make where you have to slow it down quite a bit like that. All these other ones I'm going to go through, that's not the case. You can walk immediately the next day. And a lot of people are very surprised at the layup in terms of how little pain they have. And in fact, many times they feel better within a couple days from the nerve pain they're having or the restless leg symptoms. But again, this incision, it's just slow to heal. And sometimes you have to keep this area dry for approximately 3 weeks, okay? You have to keep dressing on it. And there's another incision that sometimes we make on the top of the foot. Again, heals really quick, no problem, you walk right away. And then there's 3 other tunnels on up the leg that we do surgery on. Again, you can walk the next day. So, and in some cases when we don't do any surgery on these 2 in the foot, you just have a dressing from your ankle up to the knee, and you're back in regular shoes the next day. So just something I want you to be aware of. And again, we only do usually 1 leg at a time, make sure that it works before we do the other side. And very little layup with these procedures. And the other thing, it's very difficult for you to ruin the surgery. You know, when you're up walking around, there's nothing really that we have seen so far that you can do that would really give you a bad result. It just might slow down the healing of the incision. And that's why we slow you down when this one's done. So a little bit more information here for you to consider. And please give us a call or go to our website for more information at AndersonPodiatryCenter.com. Thank you.